personal journeys with Channel 2's Jovita Moore.
Tonight, we're going to spend some time talking about two health issues that affect millions of women. Heart disease is the #1 killer of all women, and sadly, studies still show that most women aren't even aware of this. We'll have the warning signs and risk factors, information that could save your life. We begin with a medical condition that really hits home for me and a majority of women who are ready to have children. I've been dealing with the complications of uterine fibroids. Recently, I underwent a procedure hoping it'll end the symptoms I've experienced for nearly 20 years. I started reporting here in Atlanta in 1998. But there is a large crime scene at this hour. What happened to that new car? In East Point, Jovita Moore. One of my goals as a journalist was to work in this town. Its rich history and heritage always fascinated me. Shortly after moving here, I was diagnosed with a very common female condition, uterine fibroids, which are non-cancerous tumors. I didn't even know that I had fibroids until I moved to Atlanta. And my doctor here immediately, first exam, first visit, said, "Oh, what about all these fibroids?" And I was like, "What about what?" So that's when I became aware. And then a year later, I got married. A couple of months after we got married, we got pregnant, and I miscarried. And that's when I also learned that these fibroids were now going to be an issue for me trying to have children. To get more insight about uterine fibroids, we asked Dr. Jennifer Ashton, Good Morning America's senior medical contributor and board-certified OBGYN. We brought her to Atlanta. You know, there are a lot of women who don't know what they are or have yet to be diagnosed. Talk about what fibroids are and how they affect you.
Anywhere from 50 to 80% of women will have fibroids at some point in their lives or be diagnosed with them, especially more common amongst African American women. And fibroids don't always cause a problem. They're benign muscle tumors, technically. And, you know, just because you have them doesn't mean it's necessarily going to interfere with your life. But sometimes they can cause some really significant issues for women.
Fibroid tumors, which grow in various areas of the uterus, can cause heavy menstrual periods, even bleeding between periods, pelvic pain, stomach swelling, and anemia. So it's 2017. What causes fibroids? Do we know yet?
We don't know. I mean, there are a lot of theories. Estrogen can feed fibroid growth, so women who are overweight or have high estrogen conditions can see their fibroids grow. But bottom line, we really don't know what starts that whole process.
I was diagnosed with fibroids 2 years ago. Back in 2000, I did a series of reports about fibroids, including a surgical procedure I underwent called myomectomy. I decided to have the surgery after unsuccessfully getting pregnant. He said, well, let's have the surgery to remove the fibroids. And my doctor said then, you know, I'll do everything that I can to get out as many of them as I can and also save your uterus. Which, of course, when you're 30, 35 years old, that's what you want to do, save your uterus. So after that, we decided to go ahead and have the surgery, myomectomy, to remove the fibroids. After that, 2 successful pregnancies, and everything was fine. While I was grateful to have healthy babies, as my doctor warned me, those remaining fibroids continued to grow. And what's so frustrating is you never really know, where did these things come from? Why me? Why are they there? How do I get rid of them? It's always that nagging thing, like, why? Why am I dealing with this? And then I've realized as I've gotten older and the fibroids have gotten bigger, for the past year or so, that's when it's just been these heavy cycles. And every month you just dread it because you're like, here we go again. I don't want to ruin my clothes. I don't want to, have to run to the bathroom every hour. But then you find yourself in that position where you're just like, give me a break. What do I have to do to stop this? I did some homework after my doctor told me about another treatment option for fibroids, uterine fibroid embolization, or UFE. This procedure, which doesn't involve surgery, blocks the blood supply to the fibroids, and that causes them to shrink.
The UFE treats all of the symptoms. The success rate is very high. It's much safer than surgery. It's less invasive. Patients go home with a Band-Aid right here. That's it, a Band-Aid.
Dr. John Littman is an interventional radiologist. He has more than 20 years experience in performing the UFE procedure. After reviewing images of my uterus, Dr. Littman told me I was a candidate for UFE.
I don't want to get a hysterectomy. So how does this UFE work better for me than getting a hysterectomy?
Well, all of the fibroids are treated, fortunately, because you're suffering with a number of the classic symptoms like we just talked about. So one of the great things about the UFE procedure is it treats every fibroid in the uterus. Some of the surgical options only treat some of the fibroids.
Hysterectomy is another way to remove uterine fibroid tumors. During this surgery, the entire uterus is taken out. Hysterectomies are performed by gynecologists like Dr. Ashton. However, gynecologists don't perform UFE, which keeps the uterus. And Dr. Ashton admits gynecologists sometimes don't tell women about UFE.
A lot of gynecologists don't even mention that to women because they can't perform that. And so we're conditioned to only say, well, let me help you, and this is what I can do for you, instead of here are all the options. But again, it's not one size fits all. So it's important to get all of the options and know what's right for you.
I decided to have the embolization.
Seizures, strokes, blood clots of any kind. Okay. Do you smoke?
No.
Alcohol?
No. I underwent the procedure in June. How are you?
Good. We're ready to go too.
Good.
Once we get started,
Yes.
the procedure will take about 30 to 45 minutes. You'll sleep through it all.
So it's early and I'm a little nervous, don't really know what to expect. People I talk to have all said they don't know why they waited to do this, but right now I'm just a little nervous about the whole procedure.
Good? Okay. How you doing, Jovita? Comfortable?
Dr. Littman performs UFE in a large operating room at his office. An image of my uterus is on a monitor, and Dr. Littman constantly refers to it throughout the procedure.
So we're going to go in the left uterine artery first.
He put a thin, flexible tube called a catheter into a blood vessel in my upper thigh. In that catheter, Dr. Littman injects a solution that contains tiny beads, and those beads go directly into the arteries that supply blood to the fibroids.
We're going to dilute them with some contrast. This is just saline. We're going to add some contrast so that when we inject these beads, we can see them on x-ray and know exactly where they're going.
Now, once in the uterine arteries, the beads will block the blood supply to the fibroids. The goal is to starve them, causing them to shrink. Dr. Littman repeats the same procedure on my right uterine artery.
So now we've got the right-sided roadmap, not as big as the left. So you can see that right uterine artery right here. That's the vessel we're going to try to get into. So in 30 seconds, we'll take the device out and we're done.
After the procedure, I'm moved back to my room, and after a few hours, I'm allowed to go home. Recovery is typically 5 to 7 days.
Went great. She did really well. Slept through it. Didn't feel a thing. Got all the fibroids, hopefully. We'll know that in 3 months. We'll talk to her about her symptoms in the office, making sure, hopefully, that she says she's significantly better. And then we'll look at her MRI and see, hopefully, that all the fibroids are dead.
Women's health, personal journeys. Heart disease is the #1 killer.
Now it is time for me to get an update on my uterine fibroids, which are non-cancerous tumors, a condition very common among women. Earlier, you saw how I underwent a medical procedure called uterine fibroid embolization. It's an option for some women who have fibroids and don't want to get a hysterectomy. Right now, I'm about to undergo an MRI. It's the first step in finding out whether my fibroids have shrunk.
It's time. Your feet are going to go towards the magnet. I'll lay a coil on top of your stomach. Just be very still. Nothing to...
It's been 3 months, and now in a matter of hours, I'm going to learn whether the uterine fibroid embolization procedure worked for me. Pam King, an MRI technologist, prepares to take images of my uterus. The MRI takes about 45 minutes. They get different images. I'm told to lay perfectly still so the pictures won't blur.
Okay, all done.
After the MRI, I go directly to Dr. Littman's office where he shows me the results.
So every single fibroid, and here's the axial view, this top to bottom view. And again, you can see the fibroid is dead. All of the other fibroids, 100% dead. There's no partial viability of any of them.
Back tomorrow. My main fibroid symptoms, the heavy cycle, the bloating, greatly improved by the time I saw Dr. Littman for my follow-up. But I was anxious to find out how much did the fibroid shrink.
So we've talked about the fruit analogies before, so if you had to compare March to September, was it grapefruit and...
Yeah, March, this is kind of a small grapefruit, and this is now a tangerine.
Okay,
So much smaller, by half the size. Yeah, they'll continue to shrink pretty aggressively for about a year and a half, and then the slope kind of trails down. It continues to shrink forever till menopause. Once in menopause, then it's fine. But the slope after about a year and a half flattens out pretty much. You don't get a lot more shrinkage from there.
so that's pretty good. Yeah, and there's nothing else I have to do. I don't have to do any
don't have
other
to do anything
surgical
else.
follow-up or
No,
anything.
you don't have to do
Another
anything.
MRI?
No other MRIs. And so you should do great.
Yeah.
Stay forever.
Good.
Remember, you